Good afternoon. I know everybody's hungry, and luckily Kevin covered half of my presentation, so I'm in a really good spot to make it exactly 10 minutes. I would like to start with the story of one of the most courageous children that I've met. Her name is Tatiana, and I met her a year ago in an institution in Moldova. She was lying flat on her bed in her cot. It looked pretty, but she was really not responding to her name. She was very reluctant to interact with me when I tried to play a little bit with her. And the staff told me that, you know, she doesn't talk, she doesn't sit up without assistance, and she has problems eating. She regurgitates her food. I'm a medical doctor by training, and I looked at her and I thought, she's a very young child. She looks like a 10, 15-month child. She was 3 years old, and she was placed in an institution due to the medical establishment in the country who decided that her profound Down syndrome is to be taken care in a specialist institution. Her story is, unfortunately, the story of too many children across the world who are separated from their parents, from their communities, and placed in institutional care. What do we know about children with disabilities in institutional care? We know that they are 6 times more likely than typical children to be placed in institutional care. We know that they are 4 times more likely than their peers to suffer from all forms of abuse. We know that a lot of these children are actually left in their cots, and Kevin spoke about that, with the only view of a white ceiling, if that ceiling is white and clean, without any stimulation. And a lot of them actually spend their entire childhood in that environment. We also know that they are more likely to die. I'm working in this field for 17 years now, and I've been probably to around 40 countries, not the typical tourist destinations, and I usually visit institutions. I've seen too many institutions for children with disabilities that had their own cemetery. We know that in many facilities that are specifically designed to support children with special needs, those children have no access to services. No education, no specialist health services, no diagnosis, no recreation, no rehabilitation, or any other programs. UNICEF, with support from RELAF, I know is investigating and mapping the issue of children with disabilities across this region. And the first glimpse, the research is actually telling us a very similar story. Children with disabilities are overrepresented in institutions or institutional care. A key driver for their institutionalization are prejudices. Children and people with disabilities cannot live independently. Children are segregated, and sometimes they actually live in institutions with older individuals with special needs who have probably spent their entire lives in an institutional care environment. We know that those children, despite the fact that they are diagnosed and labeled with special needs, they end up in these institutions without having an appropriate diagnosis. Therefore, they are not receiving adequate support, medical or any other kind of support, and this leads to further stigma and isolation. Children in institutions on this continent remain longer in institution than typical children. Data in Chile tells us that whilst typical kids spend about 3 years in institutional care, in the case of children with special needs, the average length of stay is 9.2 years. It's a life sentence. The proportion of children with disabilities increases with age, and further research needs to be done to understand why is that. It could be connected with 2 factors. One is the compounding impact of institutional care on children placed their early age. And second is the fact that families are struggling to support their children with disabilities at community level, where there are no services available for them, for education, for health, and where authorities decide to remove children from families to care for them in institutions. We know that prolonged institutionalization, worsening living conditions, actually lead to secondary disabilities, to reinforcing functional limitations, and reducing chances of autonomy. We know institutional care facilities are places where violence is ubiquitous. Now think about the population that I'm speaking about, children with disabilities. They are more likely to suffer all types of abuse. This is from research, mostly funded and supported by UNICEF from across the world, which actually shows us that the isolated and closed nature of institutions makes children particularly vulnerable to a wide range of abuse. And here on this side, you have a couple of country examples, just showcasing the level of violence against children. In Kazakhstan, 63% of children in children's home had been subjected to violence. In Romania, almost half of the institutionalized children confirmed beating as a routine punishment, and more than a third of children have been forced to have sex. In Middle East and North Africa, children highlighted violence in institutions. In North America, violence against children in residential institutions is 6 times more prevalent than violence in foster care. I won't go through this. So we know institutions are not an environment conducive to development. We know they are actually extremely dangerous for children with disabilities, and we know that they also produce or lead to children acquiring disabilities, sometimes short-term, sometimes long-term consequences. And we know from the Bucharest Early Intervention Project, we have the evidence on brain development, the negative impact of institutional care on young children being placed in that environment, the impact on attachment, which sits at the foundation or on our ability to develop and be fulfilled as adults in our communities, impact on behavior, psychological development, physical development as well. We know that early institutionalization of children can lead to cognitive impact, sometimes lifelong consequences. All the presenters showcased what we need to building an architecture for us being able to fulfill our potential going forward. Now, what are the implications for policy and practice? We know that there are a couple of mitigating factors around the use of institutional care, and we know that these are the key factors that influence outcomes for children. Age of entering institutional care. As Kevin said, we really need to make a commitment to ensuring that children under the age of 3 at least are never to be placed in a residential or institutional care environment. We know that the duration of institutionalization has a huge impact on the outcomes of children. Now, we know that children with disabilities are actually living their entire childhoods in institutions. It's a critical point for us to influence the development of adequate policies. We know that the nature of family care post-institutionalization is absolutely critical to improving outcomes for children. We know that we need motivated and supportive family environments where children will have a long and stable placement. The stability of the placement is absolutely critical. And something else that we all need to remember is the fact that in the most severe circumstances, institutional care leads to lifelong consequences on the development and the potential of those children. So we really need to take a very serious step to stopping the phenomena. As Kevin said, we are actually making progress. And it is also because UNICEF made a commitment to address the issue of institutionalization of young children. We need to work across 4 areas, which prove to be the ingredients for success across a number of governments in Eastern Europe, but also in other parts of the world. These 4 ingredients, once intervened, once the conditions are created, they will enable us to change stories like Tatiana's story. We need to strengthen political will for a comprehensive reform, and we should not be shy to say, eliminate institutional care. Do not allow any back doors into a system that we know it fails and fails children. Second, we need to build the capacity to deliver the transition. And it's both at government level as well as in the civil society for the service provision, as well in communities for their ability to care for their children. It's really important for us to be involved in documenting and promoting good examples of good transitions from institutions to community and family-based care. And last but not least, we need to mobilize funding. Funding for transition is in some places the only blocker that stops a government from making the transition from an institutional-based system to a community and family-based child protection system. And because I started with Tatiana, I just want to tell you that she's very happy. She learned how to dance, she loves singing, she lives in foster care, and she's helped to reunite with her family. Thank you.